Hello, I'm Dr. Bill Rudd. I'm a colon and rectal surgeon and director of the Rudd Clinic for Surgery of the Colon and Rectum in Toronto. I would like to share our experience with a fascinating new product called Anurex. What is Anurex and what does it do? Anurex is a medical appliance that uses modern technology to apply controlled cold to the rectal area for rapid, temporary relief from pain, itching, swelling, and bleeding, as seen in such common problems as hemorrhoids, fissures, hematomas, and other anorectal diseases. Everyone has experienced the comfort that applying ice brings to an area of pain and swelling. Using ice packs in the rectal area is a messy experience. Anurex supplies the practical delivery method of applying ice to the anal area. At the Rudd Clinic, to date, we have prescribed Anurex for just over 100 patients. In reviewing the results of the first 70 consecutive patients who used it, 95% were improved. More details in a moment. What does the system consist of? This is the Anurex probe, a sealed unit containing a specially formulated cooling liquid. The container, the Anurex lubricant, and the instruction manual. How does Anurex work? The cold probe, after it is frozen, disperses controlled cooling to the anorectal tissue it is in contact with. This cooling causes temporary vasoconstriction, which helps decrease the blood supply, swelling, and inflammation. This is of particular benefit in hemorrhoids and swollen anal lesions. How is Anurex used? These instructions accompany each appliance. Anurex should be stored vertically in its container in the freezer compartment of the refrigerator. It must be cooled for at least 1 hour before using. Then remove the Anurex from its container and apply lubricant both to it and the anal area. For easy insertion, lie on the side and bring the knee of the top leg up towards the chest. Separate the buttocks and then gently insert the lubricated Anurex probe into the rectum up to its base. Leave it there for 6 to 8 minutes, during which time it has delivered its beneficial cryotherapy. It should then be removed, washed with soap and water, and a further medical disinfectant may be applied as required. It is then put back into its container, placed into the compartment of the freezer, and allowed to cool for a minimum of 1 hour before it is used again. When should it be used? Quite frankly, at first I was a bit skeptical. However, I decided to try it on patients with many different kinds of problems and assess the results. To my surprise, it helped most of them and even helped a few avoid surgery. It worked best in the painful and swollen lesions, which include irritation, fissures, and underswelling, hemorrhoids, and thrombosis. In some of these severe cases, the only treatment available to date was strong analgesics or emergency surgery. We now have Anurex. It fills a huge vacuum in our treatment spectrum. Although Anurex works best in the very painful and swollen lesions, it also works in some patients with minor irritations, discomfort, and bleeding, so it is worth trying for these. However, the results may not be as dramatic. Now, for the first time, doctors and pharmacists can offer a patient a safe home care treatment for these painful, debilitating anorectal problems. In the clinic series that I mentioned, we have used Anurex now on over 100 patients with anorectal problems in our practice. I have reviewed the first 70 cases in which I have personally assessed the results. These patients were unselected. I was just trying to see if it would work and on whom. Of these 70 patients, 9 didn't use Anurex. 3 had no relief, One of these with no relief had pain, and 2 of these did not have pain. As a matter of fact, 1 had bleeding and 1 had anusitis. That means that 58 of 61 were helped. That's 95%. Which types of problems were helped by Anurex? The biggest group was severe irritation. The next commonest was postoperative pain. Then came edema and thrombosis. There were some patients with fissures, hemorrhoids, and bleeding. One patient was even helped completely with cryptitis. There was even one patient with proctalgia fugax who was cured completely by Anurex. Other patients had 20 to 100% improvement. This is remarkable because we have had no good treatment for cryptitis and especially proctalgia fugax until Anurex came along. I hope it helps subsequent cases as much. From our experience in this series, we would suggest some words of caution. First, a few patients just will not insert anything into their anal canal, no matter how hard you try to motivate them. However, if they have ever used suppositories, they should have no problems with Anurex. Second, the patient should be warned that insertion of something cold may be uncomfortable the first 2 or 3 times. But if they persist, it should become quite easy, and they will then reap the benefits. Now, just some of the many good things we learned from our series. Generally, the more painful the lesion, the better the results. Anurex is a boon for surgeons to prescribe for their postoperative patients who have pain. It makes us all feel better. There were no side effects and no reactions in this series. It seems to be safer than suppositories. Anurex is easy to clean, and it is a lot less expensive than buying several boxes of steroid suppositories. Also, it is used over and over again. Patients were often loud in their praise of Anurex in our series. One said it was terrific, and another said it was the nicest thing we ever did for him. And there were many others. In this book, there are documented a number of rather extensive studies done in medical schools and clinics in different parts of the world, which are quite complementary to this cryotherapy technique. Although it is a new product, Anurex has been well accepted in Europe and the Orient. I would expect Anurex would help pregnant and postpartum patients with anal problems, a very common condition. These are patients in whom you do not want to prescribe steroids, suppositories, or other medication because they are breastfeeding. Even though the device is inert and uses no medication, pregnant women should consult their physician prior to using Anurex. Other points about Anurex: it is available at most drugstores, and it is not expensive. It is reusable. 2, it is important for the prescriber to persuade the patient to use it faithfully for the first 3 or 4 days. 3, should there be a recurrence of the problem in the future, Anurex is handy and can be used again. The amazing thing is that Anurex will cure some patients without any other treatment. In others, it is a temporary help until other treatments can take effect. More work has to be done on why it is effective, but aside from its vasoconstrictive effect, I suspect it may alter the pH and bacterial flora of the anal canal. In summary, Anurex fills a void in our treatment of painful anorectal problems and will make it unnecessary for some of these patients to go through painful and expensive surgery. Anurex should be a welcome addition to the family physician, surgeon, and obstetrician when they see patients in their office or emergency room with painful, swollen anal problems. Most of the patients in this series were quite pleased I prescribed Anurex for them. With a 95% improvement rate in my selected group of patients, I was quite pleased too. Thank you.